Hello Mainvatam, today let's look at the big question that parents keep asking me. Which is better, government or private vaccination? And the truth and differences between painless and painful vaccines. At the time of a child's birth, the government's National Immunization Program (NIP) and the private Indian Academy of Pediatrics (IAP) schedule are similar, providing BCG, OPV, and hepatitis B. The difference begins in the later weeks. The government schedule is designed for public health, providing free protection against the most deadly diseases in India and reducing hospital visits to remain cost effective. However, the private IAP schedule includes additional vaccines to prevent other common serious diseases, providing a wider scope of personal protection. If you choose the private route, you will be given several important vaccines that are not usually found in the government schedule. The vaccines included are influenza, flu, and typhoid vaccines starting from around 6 months of age. Instead of MR, the MMR vaccine, which includes major protection against mumps. Hepatitis A to prevent severe liver infections and jaundice. Varicella, chickenpox, measles vaccine to prevent severe skin, brain, or respiratory problems. Cervical cancer vaccine for girls aged 9 and above, and to prevent oral, throat, and anal cancers in boys. The good news is that recently some government hospitals have started administering a single HPV dose only for girls. However, in private settings, 2 or 3 doses are given according to age. Additionally, the private schedule uses the complete intramuscular doses of the polio vaccine, IPV, instead of the small intradermal doses provided in government hospitals, and the separate injections for penta plus polio in government hospitals. According to the National Immunization Schedule of the Government of India, 2 separate injections are given to the child in the 6th week, 10th week, and 14th week. For parents wishing to reduce injection pain for their child in private hospitals, a single injection called hexavalent 6-in-1 is provided. What does it contain? It provides 5 vaccines of pentavalent and the polio injection, IPV, in a single syringe through a single injection. Benefit: by giving 1 injection instead of 2 injections at each visit, pain and crying are reduced. Many parents ask, if I want to change the schedules earlier, can I interchange or switch from one to another? Yes, you can get primary government vaccines for free and visit a private clinic for additional vaccines. If you miss any doses or relocate, you can easily continue or change your schedules. For example, if there are no vaccines available at the government hospital in your district, you can get them privately and should do so. Specific vaccines mean missed doses. Ensure that your vaccination card is always with you to formulate a catch-up plan. Ask which vaccines have been given to the children and write them down on the vaccination card to confirm. Now let's talk about the 6, 10, and 14-week doses and the difference between painful and painless vaccines. The injection will be the same in both the syringe and the needle. Therefore, the pain during the injection will be the same in both. The option of painless or painful is only available for vaccines that include DPT, and the difference lies entirely in the pertussis component. The painful vaccine, it uses completely killed bacteria. It causes a stronger reaction, usually resulting in fever, pain, and swelling at the injection site, but it provides better long-term protection with efficacy. It is also available at a lower cost. The painless vaccine, it uses only parts of the bacteria. It results in lower fever, pain, and swelling at the injection site. However, its efficacy is slightly lower and it is little more expensive. Building strong primary immunity is very important, which is why IAP recommends using the painful whole cell vaccine for primary doses at 6, 10, and 14 weeks. You may choose a more expensive, painless version for booster doses as the reactions, pain, and swelling at the injection site are lower. Both final schedules are safe and effective. If financial or budget issues are a constraint, the government schedule provides life-saving protection completely free of charge. However, the private IAP schedule provides better supplementary protection against diseases like typhoid, chickenpox, and cervical cancer. Whatever you choose, make sure your child receives their vaccinations accurately and completely. Missing vaccine doses is a very common situation, and the good news is that we are very successful in getting a child back on track. We call this a catch-up schedule. Whether due to illness, travel, or changes in the government vaccination schedule, if a dose is missed, it can be continued without the need to restart. No need to panic if a dose is delayed. If the vaccination date changes slightly, there is no need to start the course from the beginning. You can continue from where you left off. The most important thing, never assume that it is too late to vaccinate your child. What use is it if given this late? When you meet your children's doctor, a customized step-by-step chart can be created to ensure your child receives all necessary care safely and effectively. Dear parents, make sure to get all valuable vaccines for your children at the right time. Protect your precious children's invaluable lives from deadly and dangerous diseases. This useful information should be known to all mothers and fathers. That's why please like this video, share it with your loved ones, and subscribe to our channel. Remember, today's vaccine is a guarantee for tomorrow's healthy life. Thank you for your invaluable time. Namaste.